Hey guys, so today I just wanted to bring you a little more of a fun type video. This is going to be a what's in my clinical bag video, and let's get started. So to start, this is my bag. It's nothing special. It's just a 31 bag that my aunt gave me one Christmas, and I decided that it would be a good bag to use because it's huge. It has a ton of pockets. I can fit a lot in it. And at my school, we have to take a lot of stuff with us, so it just helped fit everything in it that I needed to take with me. So we're going to go now to the inside. Now, one thing that you're probably going to notice is that I'm an over-preparer. I have stuff for everything, and that's just how I am. That's just the type of person I am. So one of the first things that I have in here is an extra watch. I just keep an extra watch with me in case something was to happen to mine. If it was to break, the battery ran out, anything like that. My first semester of nursing school, I actually broke my watch face on one of the counters. So it was really helpful to have an extra, so I just keep that in there. And then next, I always keep a notebook. This is just a regular one subject notebook because every clinical that I have at my school, we have to do care plans. So this just helps me to write it down at clinical, and then I can enter it in the computer later. Along with care plans, I also have our nursing diagnosis book. This just has the diagnoses in it and helps you to have your interventions and things like that. It's just kind of a guide, so I always keep it with me. That way if we have any downtime at clinical, I can work on it and get it done, and it saves me a lot of time later. I also keep a case studies book. If we have a clinical that's kind of slow, or we're learning about something that we maybe didn't have a lot of time to cover in class, they'll have us do these clinical case studies, so I keep this in my bag. I keep two folders with me. I have a red one and a purple one. The first one, this one has our chart notes in it that we have to turn in every clinical. We sign our name, we have to turn those in. And then I don't have a clipboard, so I keep this one with me, and we have a side pocket on our scrubs, and I just fold it, and then it fits right down in my pocket, and I just keep that with me. I was too cheap to buy a clipboard, and I'm entering my last semester, so I didn't really know if I should buy one, if there was a point, so I keep that with me. We have to keep our lab book with us at all times. If our patient was to have labs really out of whack or anything like that, we have to look those up, and we also have to put this in our care plan, so I just keep this with me. Also keep our drug book with us. If we get to pass meds, we have to look up our meds and make sure they are all can go together, or if they can't, how we need to give them. Make sure the dosages are right, look for any side effects or reactions, so we have to keep this with us, and we also have to put our meds in our care plans. So this is part of the care plans too. Then I always keep a ton of pens and pencils with me at all times. You never know when you're going to lose one or somebody's going to need one. And then I keep two pen lights. I have this one that came with our kit. Then I have this fun one that I actually got at I think it was a job fair at one of the hospitals, and it's really bright. And I just keep it with me. But I keep those both with me if I was to need them for something. They've come in handy a lot. And I keep those in my scrub pocket. And I have this little notepad to take with me if I need to write down any information while I'm in the patient's room. This is a lot easier to get out and a lot less obnoxious to get out than that big tablet with our chart notes in it. I also keep my badge in here just so I don't lose it. This is what I have to wear when I go to the hospitals, and then I keep with me. This just has all my information on it. I'm not going to show that on camera, but that's what those are. Then I also have my bandage scissors. These have actually come in handy a lot for a lot of just little things, so always keep those with me. I keep those in my scrub pocket as well, and I like the longer, heavier ones rather than the short plastic ones. I worked at a vet clinic before I started nursing, and I found that I really liked these a lot better than I did the short, skinny, flimsy ones. These are just a lot better in my opinion, but that's just a preference for me. Then I also have extra batteries in case my pen light was to die. As you can see, it has died a lot, so I just keep these and they're extra. If it dies, I can put batteries back in it. A lot of people laugh at me for having these, but they've came in handy a lot of times, and I've shared a few of them, so that's just something that I like to keep with me. And last but not least, I always have almonds with me. This is just a quick snack, just in case I was to get hungry. Some of our clinical days are 12 hours, so I mean, that's a long time to go without eating and just having a lunch, especially me, because I'm I'm a snacker. I eat all my meals. I eat my snacks. I'm not somebody who can go all day without eating. So these are just convenient to have. They don't go bad. And they've also saved my butt a lot in our evening clinicals. We had a maternity clinical last semester where we were supposed to be there from 5 to 10, and we actually didn't get out till 11:30, so these babies saved me. And sometimes I'll keep a granola bar in there too, but I always have almonds in there. And then I also keep some tape, a little roll of tape in there. I just keep this in my scrub puck as well in case I was to need it for something. I know that I'm kind of an over-preparer, but that's just how I am. That's just me. I would take maybe my med-surg book with us, and that's just, it helps with my care plan, as well as if I have a patient that may have a condition that I'm not familiar with, I can look it up. That way I'm familiar with them, I can help them, and it helps me to do my care plan. Or if we have maternity clinical, the same with that. I'll take my maternity book with me. That way if my patients to have something else going on with them that maybe I'm not familiar with or I haven't looked at in a while, it just helps to refresh my memory and help me with my care plans. But as you can kind of tell, I'm a little bit of an over-preparer. I know there's a lot of people in my class who don't even bring half that, but it's just a personal preference for me. I would much rather have all of that stuff, not need any of it, and rather than need something and not have it. But that's just how I am. It gives me way more anxiety to not bring something than to just bring everything. It gets kind of heavy, but it's fine. Oh, and I almost forgot. My stethoscope. I had a little $15 stethoscope before. I mean, it was fine, but as you know, those don't work the best, and my sweet, sweet husband actually got this one for me for Christmas. It's a Littmann Cardiology 4. If I turn it the right way, you can see it, and I'm super excited. He was really sweet and surprised me with it. I haven't taken it out of the box yet. I haven't got to use it yet, but I'm super duper excited, and I'll show you what this is what it looks like. It's a Littmann Cardiology 4. It's hot pink. He got me the breast cancer awareness one because there's several people in my family who have had it, and that's just kind of a special thing to me. And he got my name engraved on it, but I'm super excited to use it. I can tell such a difference in it, and I'm so excited. I can't wait. But I hope you guys have enjoyed seeing what's in my clinical bag. I've enjoyed showing you. I didn't really realize in a way that I had so much stuff. But I hope you guys have enjoyed it, and I hope you'll come back. I'm planning on trying to get more videos out to you. I'm still trying to learn to edit, so just please bear with me. I'm planning on redoing my How I Study video because I didn't realize when you stabilize the camera that it like focuses in on one little thing, so I'm planning on redoing that one. But I hope you guys are enjoying your Christmas break. If you're getting ready to start, good luck, and I'll talk to you guys again soon. Bye.